I got out of high school and had a job as a manager already, and didn't think that I needed college, so I just kind of continued bumming around retail management for half my life, which equates to about 15 years. And then about the time I started coming into my 30s, I realized that that wasn't what I wanted to do, and then it was time to go back to school. And so I got into school to do an associate's degree and fell in love with science, and my family has a history with pharmacy, so pharmacy kind of called to me, and I decided that was my path. I lucked out and got an internship at a hospital. As a hospital intern pharmacist, I get to do all kinds of cool stuff, like we do sterile compounding, which is actually a technician position, but it gives me insight into how sterile compounding is done, the ratios that you use for certain drugs, what fluids drugs can go into, and sometimes what fluids drugs can't go into, which is all really applicable to school. And then I get to work some intern shifts on the floor with pharmacists and actually see what they do every day. When you really start thinking outside of the box and you recognize that pharmacy is the concentration of drug knowledge, it's not only what is the drug and what's it used for, but it's what is the drug, how does that drug work, how long does it stay in your system, how is it metabolized in the system, you know, what are the dangers of that drug, can it be effectively used in a specific patient. Like, everything that doctors know as medical doctors is great, and they're really awesome at diagnosing, but they don't get to spend half of the amount of time that we will spend learning about drugs and medication. And because of that, we are really, really useful in a lot of areas that I think haven't necessarily even been gotten to yet.